In this lecture, we are going to study Wuchereria bancrofti. Wuchereria bancrofti is a filarial nematode that, as an adult, is a thread-like worm. The female nematodes are 10 cm long and 0.2 mm wide, while the males are only about 4 cm long. The adults reside and mate in the lymphatic system, where they can produce up to 50,000 microfilaria per day. The microfilaria is 250 to 300 micrometer long, 8 micrometer wide, and circulate in peripheral blood. They can live in the host as microfilaria for up to 12 months. Adult worms take 6 to 12 months to develop from the larval stage and can live between 4 and 6 years. The disease is usually transmitted through the bite of an infectious mosquito. Life cycle. During a blood meal, an infected mosquito introduces third-stage filarial larvae into the skin of the human host, where they penetrate into the bite wound. They develop in adults that commonly reside in lymphatics. Adult females produce microfilaria, which are sheeted and have nocturnal periodicity. The microfilaria migrate into lymph and the blood channels, moving actively through the lymph and blood. The mosquito ingests the microfilaria during a blood meal. After ingestion, the microfilaria lose their sheaths, and some of them work their way through the wall of mosquito's mid-gut and reach the thoracic muscles. There, the microfilaria develop into first-stage larvae and subsequently into third-stage infective larvae. The third-stage infective larvae migrate through the hemocoel to the mosquito's proboscis and can infect another human when the mosquito takes blood meal. Symptoms: fever and chills, inflammation of the lymph nodes or lymphoadenopathy, inflammation of lymphatic vessels. Males may develop swelling in testicles, hydrocele, and females may develop swelling in breast. This is due to the obstruction of the lymph nodes near the aforementioned areas by adult worms. Elephantiasis, swelling of the limbs, hardening of the skin, pain in the swollen areas, asthma-like symptoms resulting from microfilaria traveling through the blood to the lungs and triggering an allergic response. Wuchereria, milk white urine resulting from lymphatic fluid emptying into the urinary tract. If this condition persists, it may lead to the nutrient deficiency. As you see in the picture, this is the case of elephantiasis. Diagnosis: by examination of a thick smear of blood taken in the evening and detecting the presence of microfilaria, either directly or by seeing them live under a microscope or detecting them after staining. As you see, this is the microfilaria. Treatment: diflucarbamazine is the drug of choice. Prevention: treatment of infected persons, mosquito control. The example of intestinal nematode or tissue nematode, subcutaneous filariasis, lawa, is a thread-like worm that lives under the skin in the subcutaneous fat causing lawiasis. because it is often spotted migrating in the eye, is known the eye worm. Loesis is endemic to 11 countries and 12 million Africans are infected. The disease is also known as subcutaneous filariasis or cilibar swellings or African eye worm infection, lower filariasis, and vegetative swelling. All these the disease caused by lower with different names. Loesis is carried by day-biting deer and mango flies, Crispus delicia and the Crispus timidite. They both live in rainforests and warm swamps in the central and western Africa. Their flies bite is very painful because it has to rip skin apart in order to drink blood. It does not have a narrow, sophisticated feeding tube like that of a mosquito. A deer fly is about 5 to 20 millimeter in length. Morphology: adult lower male is about 30 to 34 millimeter long and 0.35 to 0.42 millimeter thick. Lower female about 40 to 70 millimeter long and 0.5 millimeter thick. Life cycle. The life cycle of lower starts when a lower female produces microfilaria inside the skin of an infected human. The microfilaria travel in peripheral blood during daytime, but during the night non-circulation phase they reside in the lungs. When a non-infected fly takes a blood meal from an infected human, it ingests microfilaria. The microfilaria lose their sheaths, migrate from a fly midgut to the homuncle, and eventually to the thoracic muscles. There they develop into first stage and second stage, eventually into third stage, which is the infective stage, filaria larvae. The development inside the fly takes up to 2 weeks. They migrate to the fly's proboscis, the snout, and invade another human during next blood meal. The third stage larvae are transferred from the deer fly's mouth parts to the skin. They burrow into the bite wound and enter the subcutaneous layer where they mature into adults in 1 year. The cycle is completed when male and female meet and release microfilaria into bloodstream. Lower adults live up to 17 years. Symptoms: swelling usually near joints that can also be itchy as well. Worms that visibly crawl under the skin. Worms that can be seen crawling across the eyes may cause sometimes blindness. Muscle and joint pain, tiredness and fatigue. Diagnosis: the main methods of diagnosis include the presence of microfilaria in the blood, the presence of a worm in the eye, and the presence of skin swellings. This is filaria worm in the eye, as you see here. This is the deer fly, the microfilaria in the blood.